Just to give a bit of a background, Lancashire as a whole has a population of 1.2 million people. It's a pretty big place. We do have, even though we have the County Council, we have 2 unitary authorities. One of them is literally wrapped around by the County Council. We're encroaching on it pretty well in Blackburn. And we also have Blackpool Council who are working in conjunction with us. And for this piece of work that we've been developing over the last couple of years, we're also working in conjunction with our ICB, who work across Lancashire, but also South Cumbria as well. So it's a pretty big geography. So the reason that we came together to look at elements around market shaping, market management and quality assurance was that we realised, and it became really, really acutely realised during COVID, that we were really disjointed around how we worked with our provider market. We had different methods of contacting them, we had different asks of them, we had different metrics and different approaches of working with our market, because some of which was just due to practical things like the size and scale of the actual authority itself, and in terms of the investment around both our contract management and our commissioning resources that were available to work with our providers. So we realised that we needed a better way of working together during COVID, and a lot of that was fed back from the providers themselves who we work with to say to us, we're getting a phone call from you, or we're getting quality assured by you through our contract team, but we're also getting it through Blackburn because you both place people with us. So we're having the same phone calls, we're having the same conversations, 2, sometimes 3 times if we've got CHC clients as well, and you're asking pretty much the same questions, but not precisely the same questions. And is there a way we can do this better? So what we did around that time was, once we started to come out of the COVID sort of times, we realised that actually we needed to take the learning from that. We needed to grasp some of the good practice that happened during that time of collaborating and coming together and working together, alongside understanding what were the things that we could move forward with. Just to give a bit of an idea of the scale of the care market across our area, when I'm talking about that, we have over 400 care homes, and whilst we only contract with 100 domiciliary care providers, we actually have over 300 across the patch. So when I'm saying there's 2 or 3 phone calls, that is a heck of a lot of resource that's being put into those providers across the board. So what we put forward as sort of our intention as a commissioning group was to say, how do we work better together? How do we create that one version of the truth for our providers to build a better relationship with them, and to basically give our staff within the commissioning teams and the contracts teams, and also the providers, more time and have better quality conversations with them, so that we can look at innovation, development, we can look at alternative ways of working, and we can understand the challenges that they face as well, to have a much better relationship with them. And we realised that in order to do that, we needed to reduce all of the duplication. We needed to reduce all the fluff that we were asking of them at different points of time and for different reasons. And we needed to give them the capability and the time to be able to respond and react to us, and do that once. So we knew that we needed to invest in something and a platform that would work collaboratively across the different asks that we had as different authorities and as the NHS. Up to now, we have this range of services from the Access Group, some of which are across the whole board of the Lancashire and South Cumbria patch, and some of which we have chosen as the County Council to be the sort of the front runner and test and change aspect, to enable and support our other authorities to see the results before they put the investment in. Because the main thing that we've realised is through this is we need to share the risk and we need to share the benefits. The bit that I really like when you were talking about the tech work was saying there's this implication, this implication, this implication. And one of the challenging conversations that we have, particularly around Better Care Fund, is that's great that we've saved you a hospital admission and saved you that funding, but we're stumping up the money in social care. So how do we have a better conversation around that sort of thing? And that's the conversation that we were having around our input and our investment into the Access technology. The software and the technology is brilliant, and it will really, really help. And it has helped us, and it continues to do. However, it only works if you do the culture piece alongside it. So the elements that we have taken the learning from around this journey is that we can't underestimate the impact that it has on culture and practice. We know that we have staff who are really wedded to the way that they've always done things, and we need to sit down and show them the benefits and show them how things can be improved and work better for them, and show them the difference that they can make. We made an error, I feel, in the way that we implemented it, because I think we just assumed that because we worked well together it would work. And there were aspects around governance and contracting and all sorts of different things that got in the way that we probably, on reflection, would have taken a little bit more time and looked at, could we have a joint contract for something simple like how we commission residential care, for example, so that at the very least, when we're talking about what we're monitoring, we have got an agreement before we then start trying to monitor that. And using what's on the shelf as well. We've taken a lot of learning about how sometimes tailoring and tweaking can take so much time that we actually then have a challenge around getting some results out of it. So we're taking now a bit more of a pragmatic approach around, okay, let's use what's on the shelf, and then if we're finding challenges, we can work in conjunction and partnership with the guys at Access and with our other partners around what the rationale is around that and how we might want to look at it differently. That said, the benefits that we're starting to see are massive and will improve over time as we get more used to utilising the different modules within the Access sort of group of services. And I think the discussions that we had this morning around some of the working across some of those modules will really pay dividends for us as well. What we are finding is, because we've had that approach to shared risk and shared benefits, we're looking at how do we share some of that workload. So, for example, what we're finding now is we're having a different conversation between our contracts and commissionings team to say, actually, can we monitor this provider once, and can we agree who it is and which organisation it is, and you can do it for everybody. So what that then does is it releases the capacity within our teams, but also releases a cost saving potentially in the longer term to say, we've got an agreement on how we do this, and we're going to do it once, and we're all going to ask the same questions. I've literally just been having a conversation today with Callum around, and is there an opportunity we can start to look wider and look regionally and look at things like, how does that shape our market? How do we look at things like benchmarking our costings and what we're charging, and how do we work then with our providers to look at where our challenging areas are? So, for example, one of the things we're starting to look at is the CM module, but we're using it around our reablement and intermediate care services. And we're utilising that not just to look at the provider aspects around delivery of planned and actuals, but looking at, have we got those pathways and processes right? Have we got challenges within our assessment capability? Is there other information in there that's pulling together to give us a really good live dashboard view of the health of our provider market and where we want it to go in the future? So as I've said, we do have future intentions around this. We have purchased, and we're in the process of developing a live electronic market position statement across the 4 authorities. So then that will mean that in the commission team, we always hate November because it means that market position statement time is there, and we have to pull all this information and data from various places in order to come up with a document that then goes out on our website and nobody ever reads. So we are utilising the live data that we're going to be getting through PAMMS, through the CM module and other places to give us that data and intelligence live at that point in time. And that gives us a better position as commissioners to be able to say, actually, this is the direction of travel that I want to see our market going into. As I said, we're utilising that, the CM module, and we're looking to do a review of that pilot for intermediate care. There is a desire to widen that access across the whole of our home care, But what we want to see, we know that the proposition is different between what we're asking of it for intermediate carers to what we will want it to do for home care. So we're going to look at being really clear and being a lot more upfront about what is our challenge, what is our ask of the software, what is our ask of that development going forward, so that we can shape and mould that into something that is going to prove useful for us as commissioners, useful for our operational teams working sort of on the ground level with individuals, but also working more collaboratively with partners such as our NHS partners. As I said, one of our challenges is around that single contracting approach. So we're starting to spend some time to say, actually, what are the things that we contract want? And we have a sort of a specific template that we utilise across the whole partnership that then saves time, ensures that we can do that matching apples with our partners and with our neighbours to be able to have better conversations around what the market looks like. And then we've talked about it a lot this morning, but we want to be more forward-facing around this. We want to be future-proofing this. We've already discussed the AI capabilities on our table. I was saying I'd really love it if there was a way of harvesting the case notes to be able to look at themes and trends, so we can start to look at what's the rationale. Why are people ringing us for support? They don't ring us to say, I need an assessment. Nobody thinks that. People say, my mum's had a fall, or I'm starting to struggle with this, or this is happening with my neighbour. And are we collating that information and that intelligence to be able to give us a really clear understanding, not just of the numbers, but the reasons and the rationale why people are contacting adult social care? Then that will help to develop our support offer and hopefully move our market and shape it in a way that is fit for the future and hopefully more cost effective.